Hey you guys, good morning. So I wanted to talk to you all about my post-op appointment. It was very quick. He didn't do any examination of my actual vaginal cuff. He just looked at the incisions on my stomach. I still had glue on my incisions. This was approximately 4 weeks after surgery. He told me that I need to go ahead and work that glue off. I had been very careful not to do a whole lot of scrubbing and bathing of my belly. I would just kind of go over my belly with soap and water, but I didn't rub really hard because I wasn't too sure, especially since I was having seeping from some of the incisions. I didn't want to break them open. So I wasn't real aggressive with cleaning my belly or rubbing my belly. I was cleaning it, but I wasn't real aggressive with rubbing it. And so he had told me that I can go ahead and start to work that glue off. And I did that with alcohol, soap and water, and over time, it started to just kind of turn into like a little rubber ball, and I was able to pull it off. The incision in the center of my stomach above my belly button, that incision had a scab on it even after 4 weeks. And me taking this glue off, he said it would be fine and that it should all be healed from the inside. So what I realized just last week, like I said, I'm 6 weeks post-op. So another 2 weeks later, I still had like thread in there from the incision being sewn together. So I thought that was kind of weird. I didn't want to pull on it. It feels like it's dissolved since I noticed it. So I'm not going to worry about that either. So I spoke with him about hormone replacement therapy and told him that I was having really bad hot flashes. Like every 5 minutes, I felt like I was having a flash that would last about a minute to a minute and a half. And I told him how I was suffering with hot flashes and night sweats prior to, this was really something I was sharing with my primary care provider more than I was him because I hadn't seen him as often. And how I was having some brain fog and just dealing with some other issues, especially with feeling like I had to urinate a little bit more often. So he prescribed me a 0.05 estrogen patch, estradiol patch. We picked that up the next day, and within 3 days, I started to feel some relief from the hot flashes. I was surprised because most women talked about it being 2 weeks before they started to feel some relief from hot flashes and some other menopause symptoms. So I started to feel some relief, especially from the hot flashes within 3 days. And I was so happy about that, to be able to get some relief, to be able to sleep all night without having to pull the covers off and on, and not always having to sleep with a fan in my face. I noticed almost immediately that I had more energy and that my mood was better. I had started to feel not depressed, but just not the happiest. But when I put the patch on, I would say within the first 24 hours, I just started to feel a little lighter, more happier mood. I don't know if it was because I was anticipating feeling good, so I started to match that same energy of the anticipation, or if the estrogen was actually making me feel better. So it's been about 2 weeks since I've started the patch, and it's a patch that I take on and off every 2 days. What I've been doing is applying the patch on whatever day that I'm supposed to, 3 hours prior to taking off the patch that I had on previously. I feel like, in my mind, not that that was the instructions, but it's helping me not to have any dip in estrogen levels in my body if I go ahead and apply the patch while I still have the old patch on. I'm thinking the old patch is running out of medicine or is out of medicine anyway, so putting a new patch on isn't giving me like an additional dose. I feel like it's giving me time to get the patch, the medicine from the new patch, into my system before I take the old patch off. I noticed a sense of clarity over the last week or so, where I feel like when I'm having a conversation, I'm not losing my words, and that I'm actually being able to complete a sentence without having to search my brain for the next thought. I feel like it's given me a great deal of energy to be able to just get up and exercise. During the healing process, we are supposed to take it slow, take it easy. And I've been doing that. But when I started taking the estrogen, I felt more of a push to get up and do things. So I started doing more around the house, started doing more laundry, started cooking more meals, started doing more prep from our garden. So it's really been a game changer as far as my energy is concerned. I am on the patch in addition to a 3 milligram testosterone cream. I arrived at that particular cream or this particular combination because prior to actually having the surgery, my primary care physician noticed during some blood work that my testosterone was low. So she prescribed me a 1 milligram testosterone cream compounded because it's technically not approved by the FDA for women, even though we make it. Just like men make it, we just don't make it in abundance like men do. We did the 1 milligram for 30 days and my numbers didn't move too much. I was less than 3 milligram or less than 3, whatever the level is, like non-existent, in other words, of my testosterone levels. So she bumped it up to 3 milligrams to see if I'm getting any more of the testosterone levels to go up. Other than my testosterone being low as far as like my lab numbers, I had no sex drive. Just gonna keep it real. I had no desire to initiate sex. It wasn't even really like on my mind. So I was really concerned about that because, you know, we're a young couple. I'm 49, my husband is in his early 50s. Even if we weren't a young couple and we were an older couple, we still want to be active and enjoy each other. And I didn't want to be the one that just didn't feel like it or didn't have any desire. And of course, when you have stress and you're overworked and dealing with a lot of other things and you're not doing your self-care, of course, you can always still feel like that even without your testosterone being low. But knowing that it was low and how I was feeling, like it never crossed my mind, and like I didn't have any energy. I used to work out really heavy and do weights and things like that. I'm not gonna say work out heavy, let me take that back. I used to exercise on a regular basis and had started to lift some weights. And I wasn't building any muscle tone. And I started to get more belly fat around my midsection. And those can be symptoms of low testosterone as well as low estrogen. So I knew something was going on. I had blood work done and my numbers for all of my female reproductive numbers, my follicle stimulating hormone, progesterone, estrogen, were all in postmenopausal levels, and my testosterone was low as well. That prompted her to go ahead and prescribe me a testosterone cream that she sends to a compounding pharmacist, which is about an hour away from me. So they only make my cream on Tuesdays. So when I get close to running out, I always make sure I call on a Friday so they can make it the following Tuesday and it'll get delivered by the end of that week. Circling back to the estradiol patch, my appetite has decreased tremendously. My cravings for sugar have diminished. When I get something, like when my mind thinks, oh, I want those chocolate covered nuts, when I get them and eat them, they don't taste as good as they did prior to the estradiol patch. I don't know if this is mental or if this is something that estrogen really does for the body, but I'm loving it. It's helping me to keep my portion control down. I'm actually having to tell myself it's time to eat instead of just always wondering, where's my next meal? Where's my next meal? So I'm been really happy about this, because I'm concerned with my weight gain over the last 2 years. I've gone from like 155 to 165. Now I'm down to 164. And I hope that with being on estrogen and testosterone that I'll be able to slim the areas I want to slim down. My midsection had gotten quite fluffy and wide, and I don't have hips, so I just look like a straight up and down, you know, I didn't want to look like a block of cheese, right? So I'm looking forward to really being able to get this shape back that I had prior to the surgery and all of my hormone levels being out of whack. So just to recap, the benefits of the estradiol patch that I've noticed so far after being on it for about 2 weeks is appetite suppression, sweet cravings have diminished, I don't feel as bloated, I'm having more mental clarity, and my overall mood has improved. So that's where I am with week 2. If you're on the fence with getting the patch because you're concerned with how it would make you feel, and you are a candidate for it, and you've talked with your doctor, and you can actually try it, I would say go for it. It doesn't hurt to try. If it doesn't work for you, you can always get off. There are so many other options as far as like vaginal creams if you're having dryness and issues with your woman area or your lady parts. There is a pill you can take if you don't want to wear the patch, or the patch doesn't stay on or it irritates your skin. Or there's like different sprays and things that you can use. I've heard on Ally or Alloy Health, they talk about different options that they offer as well. So if your doctor isn't, even if your doctor isn't willing to have the conversation with you about getting on estrogen, you might want to check out one of the telehealth docs that offer the different options just to give it a try. I feel like it's really worth it. So I am going to finish up my walk. I am up to a 1.5 mile walk right now, and I feel really good. I'm hopeful to get back to my 3-mile walk every morning and to start getting back up early. Being off for 6 weeks had me laying in the bed pretty late, which is what I needed because I needed to recover. But I'm ready to get back to my 6 a.m., 7 a.m. morning walks, 3 miles, and back to meal prepping and all those things. So if you're interested in my journey, like and subscribe my channel. I do a lot of cooking and I offer a lot of recipes. All of them aren't healthy. Some of them are just things that I want to try that I've seen on TikTok or with another YouTuber or something. So like, subscribe, and maybe share with some of your family and friends. But until then, I'll see you next time. Be well.